with the code 204, titled Geography Without Borders, COVID-19, organized by Universidad Autónoma del Estado de México, Autonomous University of Mexico State. Before we begin, a couple of housekeeping notes. Please turn off your videos and microphones. Please also note that this session will be recorded. Please don't forget to tweet about your favorite events and panels at the conference using @SciencePolicy and hashtag CSPC 2020. In the chat box, I will be adding the link of the short survey that should take only 1 or 2 minutes to fill out. You can fill this survey out at any point during the session. I encourage you all to fill out this survey, please, to help us make CSPC better in the future, especially as we are navigating this new online medium. Finally, we are very pleased to have a very diverse group of panelists from Mexico, Brazil, Portugal, Canada, and some interventions may require for me to translate. So the panelists will speak in their native language, Spanish or Portuguese, and I will do the corresponding translation in English for your understanding. Without further ado, I will pass things now over to Dr. Marcela Virginia Santana Juárez, who is the moderator of this session. Thank you.
Thank you, Maestra Edna Mata. We thank the President of CSPC, Dr. Merdar Hariri, for giving us the opportunity to participate in this interesting conference. Good morning, everybody. Welcome to Canadian Science Policy Conference, in specific to Geography Without Borders COVID-19, number 204. The panelists are Dr. Eduarda Marques da Costa. She's born, welcome, Dr. Eduarda. She's born in Lisbon in 1966, Associate Professor of the Institute of Geography and Spatial Planning of University of Lisbon. She teaches geography and spatial planning since 1990. She is research in the Center of Geographical Studies since 1987 and since 2009. That is coordinator of modeling and spatial planning research group. And Dr. Emmanuelle Quentin, you're welcome this panel. She's bachelor in mathematics, informatics, master in weather sciences, and PhD in remote sensing from Canadian University, and 9 years of experience in the Inter-American Water Resources Center, now Institute in Mexico. After working 6 years at the National Institute of Public Health Research in Ecuador, setting of the EPICIC Research Center. She joined the Center for Research in Public Health and Clinical Epidemiology suspect at the UTE University in Quito, where she continues to apply geomatic science to health problems based in environmental and socioeconomic geodatabase. Dr. Giovanna Santana Castañeda, you're welcome at this panel. Giovanna Santana Castañeda has a university degree in geoinformatics sciences and a master's degree in spatial analysis and geoinformatics, both from the Faculty of Geography at the Autonomous University of the State of Mexico. She also has a PhD in geography by the National Autonomous University of Mexico. She has main lines of research are quantitative geography, spatial models, spatial analysis, multi-criterion, evaluation, geography information system, HIS, automated cartography, social geography, health geography, and urban geography. And my name is Marcela Virginia Santana Juárez. I am a professor, a researcher in the Faculty of Geography of the University State of Mexico, PhD in Geography, passed with merit at UNAM. Master degree in urban and regional planning and UAEM, Bachelor in Geography at UM. I have given the merit Benito Juárez Medal of Merit award by the Mexican Society of Geography and Statistics. My lines of research are geographical health, urban geography, and I had participated in many projects of CONACYT and our university. You're welcome, and we will start our panel discussion by formulate question will guide the conversation and ensure that each speaker will have the opportunity to make their questions, their contributions. The first question is, can you summarize how the pandemic spread in your respective country? Key dates, which regions were most affected, current status, and what were the surveillance, prevention, and control measures imposed and their effectiveness? Please, Dr. Eduarda.
Hello. Good morning for you, good afternoon for European, and maybe good night for others if it is a world conference. Thank you for the opportunity to present the results of some cases of the other part of Atlantic. And I would to thank also to Marcela that remembered me to join to you. So I hope the conference will be interesting for everybody. And I hope so that it will be a start for cooperation between policy in policy science, between this policy science and also the health science. We need that, as you see in now with this context. So answering to the question that Marcela put to me, that can you summarize how the pandemic spread in our country, some key dates, which regions and the status. I would like to share, not a big PowerPoint, it's only 3 slides, but to show where is my country that is very small, and despite being very small, is very heterogeneous, and could be an example what in fact is happening for almost countries in the world. Portugal is here near Spain, a small country. You see in size, it's 1/50 of the Spanish context, and in population is also almost 150 because we have around 10 million inhabitants and not a big density. We have 111 population density by square kilometers. In any case, the country is very heterogeneous. And you look at this is the daily new confirmed cases, 19 November, and you see that we are not in the worst colors, okay, of the grid, but that in any case, this is a large expression of the pandemic in our country. When we look at the first cases, we started it to 2nd March with two regions with imported cases from Italy and from Spain. The question related to Italy, it was related with the international fires of textile. And in the case of the other case, it was with Spain, it's labor mobility, labor force mobility. So completely related with economic activities. But in 15 days, we have sprawled for all the regions, and we had registered more incidents in 2 metropolitan areas. Despite the map only show the regions, we have the more incidents in Lisbon metro area, that is here, 3 million people in this part, and Porto, or the region of Porto metro area, about 1.5 million people. So that means that more than half the population in 2 territories, metropolitan territories, were leading the sprawl of the pandemic. When we look at this graph, now we see the status now. We are in a very worst position than we were in the bad days of April or March. we are really in bad position this moment. And you see in red, we have the state of emergency. We declare it, of course, in March, as everyone, but we start with the progressive end of lockdown, started in the end of April and until June. And it was interesting that we had national measures, but in the phase of in the summertime, we have more territorial and specific measures. And maybe that would be also interesting to discuss. How is the effectiveness having national or specific and territorial delimited measures for restriction? Now we are here in this phase again, state of emergency. It's a partial lockdown. This time we cannot be out at home after 11. We cannot go to restaurants after 10, and in the weekend we cannot go out after lunch. So it's a partial lockdown, but all the activities are teaching, and for example, the schools are working 100%. We have teleworking in service, but all the industrial and agriculture and the distribution, this means the retail and the logistic, is working in totally. So that maybe could explain almost of the insuccess of the partial lockdowns we defined. We have now about 7,000 new cases a day. That is too much for us because our maximum was 2,000 in March, April. We have 70 deaths a day. That is too much for us also, more than 4 times that we had before. And we have a very high average rate of infections now in 3/4 of the municipalities of the country. I suppose that could synthesize what is happening in what was happening and is happening now in our country. We have the starting process here concentrated in the 2 metro areas, and then during the months you look at the sprawling. And when we made the incidents, the number of cases by the number of cases by inhabitants, we have this picture, very bad picture near the border here, but also very bad picture in the metro areas, but all the countries almost compromised with this sprawl. This is the rate of infection of 1 week ago, and this is the average of the 14 last days, and you see we are almost dark in every part of the country. In the right part of this slide, you can see these explanations, okay? We started by the more dense areas. This is the urban work and the constant employment, and this is the concentration, but then link it to the aging process and link it also to mobility that is traduced here in the aging index, also in the pensionists or the employment bans since we sprawled the pandemic for all. Key moments. After summer, we are talking about the beginning of September, we feel it already that we have a second wave because everything restart with intensity, and that is the problem. Because in July and August, people were sprawled in the country, were in the beach, were everywhere, and there is no school and no teaching activities. And that explanation for the second wave in Europe is completely linked to this return to pressure, to this return to the activities, and in fact linked to academic activities, to school activities, and also to economic activities. The second part of the question put it by Marcela is were the surveillance, prevention, and the control measures imposed effective? Yes, they were in the beginning, but now the partial lockdown shows that is not enough. So that is a very big conflict between economy and between what we talk about, the health and the public health decision. And in fact, what is more critical in this moment is that people look at the numbers and they are not pressured by them. So they used to these numbers, to these figures. They are used to the number of deaths day. They are used to the number of infected day. And the question of the economy is more important because they are a large percentage of people in unemployment. Some of the regions of our country was totally dependent on tourist activities, and that disappeared. Also, the question of exportation of products are quite down in this moment. So the preoccupations of people are more centered now in having a salary in the end of the month than being at home or deciding the other questions. So this is a very complicated situation. They need a moment to think of best solutions. And in fact, the best way to communicate what is better, and maybe the governments make some relation because costs and the effectiveness of the measures and support some of the activities will be more adequate and more effective than these partial lockdowns that is nothing for a message, because the message is not current. And I finished now. So
thank you. Thank you very much, Dr. Eduarda. We are continuing with Dr. Emmanuelle Quentin. Welcome.
Thank you. Thank you for the invitation to this panel. So I will present the situation in Ecuador. I will show you some diapositives. So about where are we located? So Ecuador is also a relatively small country. We are in the South Hemisphere. As you can see in those mondial maps, I have mapped mortality, morbidity, and lethality. So it's in the death data that Ecuador is very bad located. In morbidity, it might seem not so awful, but those indicators are highly dependent of capacity to test adequately. And we know that in Ecuador is very low, the test we have. We have a very high positivity. And regarding the Ecuador situation, so we began the state of exception with curfew, it means a lockdown in March, as mostly every countries. There was a traffic light systems. It means we have cities in red, in yellow, and in green. But this system has been implemented at first, but it's not working very well because each municipalities have the choice or should ask permission to change its color, and so it has become to be very confusing because there is many rules different in each municipality. And it's not so helpful, these systems that has been implemented. We are in Quito, where I live. We are in yellow since June, and well, nothing is it's happening. But they change rule now with the end of the year, and there is some festivities. Normally there is a Quito day, and the end of the year festivities that they are trying to see what measures they will have to implement. I have to mention in Ecuador, because of delay, we couldn't have a state of exception larger than in September, so it has been put an end to the state of exception. It doesn't change much because only the curfew, we are not so much with the curfew. I can mention also that the hospital, they are always been at top of capacity. It's not very clear. The data are not so freely obtainable. And, but we know that by all what we can learn from medicals that they are at the top of capacity almost every time. There is some waiting list that is absurd for to be in the urgency centers, units. So it's very complicated on this side. We are still, all education is at distance. We don't have nothing in presence. There is a limit for restaurants and bus, but they are not so well followed. There is no nightlife. The problem very clear is more poverty and violence, because economically a lot of people don't have we will be able to make more finance analysis later, because all this data is it's registered for the moment, and we can see some trends, but the better analysis will be able to do them later, I suppose. If I speak about numbers, in November, well, for a population of 17 million, we are with this number of cases, PCR proof, more than 183,000 cases, but the positivity is very high. So there is not enough proof of COVID in the country. It's really, and there is some rapid proof, but they are so bad that not very useful. The very high problem is the problem of death, because it's only, it might seem not so much, 30,000 deaths reported, but if we analyze the data for overdose, excess mortality, it's awful, it's very high. It's 40,000 compared, if we compare with 5 years before, mean value of the 5 years before. So it's very high. There is very sub-register, very important. And this is what we are making the analysis, the spatial analysis. We can see the progression of the excess mortality from the coast and more the Amazonian part. And well, it's not the latest data. This is a global vision, because it has been in Guayas, in the coast, that the impact in March has been very high. But no, in Quito, where we are located in the center of the country, we never have finished the first wave, because we are increasing every day. There is more and more cases. So we can see that we are going in a second wave, because we haven't never finished the first wave. It might be interesting to analyze the difference in space of what is happening in this pandemic, because we can see there is a pattern very different in Guayaquil. Guayaquil, it has been impacted very highly at the beginning, and now it's not so much. But in Quito, it's not the same pattern. We are always having a lot of cases. So this is a situation we can't. It's very difficult to analyze sociologically the situation, and if the measure have been very useful. It doesn't seem too much, as it was said. People are, well, it's difficult because there all seems to be like we have to have a normal life. So we have some measures that are still working. We have with the mask obligatory, but we doesn't see the end, what could be more useful. But I suppose that some analysis after the main period of this pandemic will end, we can see what have been more useful or not. I hope so. This might be my summary for the situation of Ecuador. And thank you for the opportunity.
Thank you, Dr. Emmanuelle. I will participate about the situation in Mexico. One moment. In Wuhan, China, on December 10th, 2019, the COVID-19 pandemic began. The first case in America was registered on January 21st, 2020 in the United States. It was about a man who had recently traveled to China. In Mexico, the first case imported from Italy was registered on February 28 in this year. The first phase covers from February 28 to March 23, 2020. From the point of view of the socio-spatial conditioning factors, according to Busai and Santana, 2018, the social determinants of health, CSDH, have been considered by the World Health Organization as the social and contextual characteristics that deterministically influence the human health situation. Then the possibilities emerges as an alternative in the search for solution. Between the determinate and the indeterminate, the position of the social spatial conditioning factors. Supports are intermediate location with special support, proposing the use of the concept social spatial conditioners of health. Federal government authorities indicate that the COVID-19 pandemic in Mexico will be long, in order to avoid collapsing health services. Some of the sanitary measures implemented by the federal government and state government have been quarantine, strict and partial, the stay-home policy, the healthy distance, basic hygiene measures like wearing face mask, gloves, mask personal, hygiene at home, sneezing, covering the nose with the arm, financial support for vulnerable groups such as the elderly population, the population with some disability, scholarships for students, and loans for small industries. Spaces were adapted and are being adapted to attend patients with COVID-19. In the first phase of the pandemic, a condition that influenced the spread of the diseases was the mobility of the population through transcontinental and national flights, with metropolitan areas and cities being the epicenters of the pandemic. Other fundamental determinants were the distribution of the population, the density of population, and the vulnerable population groups, such as the elderly population and the comorbidities that play an important role in deaths and cases due to COVID-19. The affected areas include Mexico City, the main metropolitan areas and state capitals, that is, urban areas. The second phase, one moment. The second phase covers from March 24 to April 2020. The spread reaches tourists and border cities in the north, as well as in the state of Tabasco, Sinaloa, and Baja California. Mexico City and the state of Mexico continue with the highest values. The third phase covers from April 21 to May 31st, 2020. They has 90,664 cases and 90,939 deaths were registered on May 31st, 2020. The spread of the pandemic is expanding towards tourist cities, mainly on the Pacific side, in the states of Baja California Sur, Sonora, Guerrero, and Michoacán. Third phase, new conditions normal from June the 1st, is the characterized by the implementation of the color-based epidemic risks measures as one of the federal government sanitary measures for the opening of certain economic activities at the state level. Case trends show meaningful increases and deaths show low but steady increases. With regard to new cases and deaths registered in one day, they show gradual increases until the month of July, in which the highest values were registered later. There is a gradual decrease and the lowest values from October 2nd to 4, 2020. Afterwards, there were increases and decreases with the peak in new cases on October 10th, reaching 7,696. In the new normal, the social spatial conditioning factors that have a greater importance in the spread of the pandemic are mobility, cultural aspect, such as the celebration of national holidays, like September 15, the celebration of saint festivities, both in cities and rural areas. Some cross private party celebration, etc. Some people consider sanitary measures, but others do not. Therefore, when health measures are flexible, there are ascending and descending trends in the absolute number of cases and deaths, with a greater number of new cases and an increasingly smaller number of deaths, due to the fact that the protocols and medical treatments are improving and people now know the symptoms which may help to save lives. On October 31st, 2000, this year, 8 months after the start of the pandemic, America was declared the continent with the most cases and confirmed deaths due to COVID-19. Worldwide, of the same day, there were 45,428,731 confirmed cases and 1,185,721 total deaths in all the world. In Mexico, there were 9,024,962 cases and 91,753 total deaths. The states with the highest values are Mexico City, Nuevo León, Estado de México, Guanajuato, and Coahuila. The states with the highest rates of unfortunate deaths are Mexico City and the state of Mexico, with 111 and 155 respectively. Well, we are continue the next questions. All very, very interesting in this moment, very dangerous for all the world. The second question is, how has the scientific community been able to contribute, particularly with regard to geographical analysis? We are going to start with Dr. Eduarda.
Hello.
Hello.
Marcela, can you take out?
Yes.
Gracias. Gracias, Marcela.
One moment.
Okay, thank you. Okay. I suppose the community, there is two big groups. The group that could help more linked to health, and the others that could help more linking thinking in the social determinants and relate this with the economy, and how we can solve the impacts of the pandemic in the other sectors. So there are two ways. One is to control pandemic, okay, needs more epidemiological strategy, and the other could be linked to the impacts system, thinking about how to monitoring, how to develop measures, how to see what is more efficient to counterbalance the impacts in the economy, and that is for social science, mainly for social science, economic and social science. So that's two approach. The other approach, it's not depending on the type of people or the science, but is the scale of analysis. And that is very sensitive for us geographers, no? Because for my case, I'm a geographer, and is very sensitive because the competences of the countries, the regions, and the municipalities are not at the same level. So that demands a big effort of combination of coherence between the policies and the different levels of policies. And that is an extra work, because one of the problems that we assist now, it's that we see that the sectors of the economy are thinking in a way, and the public health at local system is thinking in another way, and the public health and the health, not public health, but the general health is worried with other things. If hospitals have capacity, if we have vaccines, so there are different levels. So for the scientific community, it's a big challenge to produce new data, to produce interpretations, to produce knowledge about what are the main reasons for each or for that or for that. But in fact, the big challenge, it's that the communities that are working with the pandemic, listening and could integrate the knowledge that a scientific community produces in their conclusions. And if you don't mind, I would like to show you, I suppose it's data. I have been working in two projects that were financed by our financial science, Foundation for Science, and what we have been producing. We have, of course, the dashboards. It's the best way to give information to people. But more than that, we are making typologies that are related, the number of cases by size of the municipalities, and then we try to understand how they are related. Of course, different indicators, the rate of infections, number of infections per data. We have the evolution, of course, the data related with evolution like this. All the data is the same with the municipalities in different size of the municipality, the patterns. But if this kind of information is not discussed in a forum to be integrated with the policy level, this is nothing, okay? In this project, we work with the National School of Public Health. We work also with the Faculty of Medicine, that is this, the Faculty of Pharmacy. But if you don't have this, we have now the Association for Health, for the primary care here, and we have also linked to health these groups. If you don't have these groups, what we are producing here is not enough useful, because it's knowledge for everybody, or for journalists, or for someone write a small new, and it's not integrated. So the big challenge, it's not only to produce new knowledge, but it's to integrate the knowledge in the policy. And that demands an extra effort of us as academics, because we must be more conscient that if we are not able to make provisions, that's the guys that work with us, that are linked to the system of health, public system of health, they need answers for the future. Of course, it is important to explain what have happened in this process these months, but it's very important to understand the past, acting very fast in the present, and anticipate very, very fast the future. And that is the way that make useful our contribution. And that is the big challenge. So the scientific community, looking at the different explanations, could be really useful if you can make the provisions, if you can make scenarios, and if you can integrate our information in monitoring systems. And at the same time, I can share again, I suppose. Yes, this one, I suppose. I would like to show this here. That is a question, a survey that we are making. It's online, and it's every day we look at the answers. And it's a survey about mobility. And the mobility is linked for the economic activities, okay? If you look at the database of our national entity, the Trace COVID, where they registered the positive cases and where they registered all the tests they do, they don't have the occupation of people. They have the address where people live, but they don't have the occupation, and they don't have where they work or where they study. And that is a nonsense for public health. So now it's too late to change the database for the past, but it's time to change the database for the future. Integrate, for example, new indicators, new variables that could give us the flows. Because one of the problems of this is the flows. People go to work and study in different parts, so it's the flow. And the survey is now in 2 months online, and is helping us to demonstrate to the public health entities, that the mobility is one of the key elements in the process. And the mobility, it's obliged to be incorporated in the national database where they register COVID cases. So think about it. It doesn't make sense if you make municipal restrictions, if you don't know where people work. You know where people live, you make restrictions where people live, but then you don't know what happened when people work and the flow where they are going to spread the pandemic. So municipal responses could not be limited to the where people live, and the registration of cases where people live should be integrated in a more enlarged way. These people live here, but this daily movement occupies a distance that maybe crosses 3 municipalities. And that is the way to understand the process. So I suppose that academy and researchers could help this way to contribute to a better knowledge, but also to change the future. If we spend too much time explaining the past, I suppose these entities doesn't recognize, and I'm not saying that doesn't recognize, but they don't think so useful, our contribution. So it's the big challenge. I leave this for the discussion. I leave to
Thank you. Thank you, Doctora Eduarda. We are going to continue with Doctora Emmanuelle Quentin.
Yes, thank you.
Please.
Yeah, I can tell for my point of view in Ecuador, we had a big problem with the data because they are not very transparent. There is no, not much open data. So we are fighting to have the data, to capture data from those dashboards that do not leave the data freely available. So it's one of the complications we have. We are trying to have our epidemiologic model and spatial epidemiologic model more accurate. And this is a good opportunity for us, for the scientific community, to have a natural experiment that we will have a lot of database to analyze after, if we can have the opportunity to have all the data available. So we can take it like this for the moment, because the government here is not very open to listen to the academy. So we have to go by the media to transfer the information to the population, but it's not very sure that it's well transferred. We have the opportunity to educate students, but it's a larger time thinking of changing things. Yes, I know it's the point that mentioned before, that we would like our results to be integrated in policies, but it's very, very hard. I think we have to fight about that more here, and we know that if we have the collaboration, those type of events, I think, are useful for us to make more public what we are doing, and to see, to have some way to see what other groups are doing and how we can collaborate more, and help each other with the conclusion we can have in some regions. So I am not so positive right now for the contributions the scientific community have the opportunity to give in Ecuador, but I think it's a large term effort that we have to continue. I think I will stop here. Thank you.
Well, thank you very much. And we are continue. with Doctora Giovanna Santana, please.
First of all, thank you very much for the invitation. It is a pleasure for me to be here with such distinguished representatives of our guild. It should not be forgotten that geography has always known what its role in society is, and that health largely has to do with the environment in which people live, whose characteristics can give us indications of the behavior of a disease, if it has a special pattern, what it is, and how it will evolve in the future. Geography is increasingly playing very important roles, and with the new geotechnological developments, it has joined the first line of defense in the fight against the new coronavirus. With the use of different spatial analysis techniques, geography is capable of generating cartography and tools to identify critical areas with a high degree of detail, which helps in decision-making strategies. The importance of the role of geography lies in the prevention and promotion of health, in this case both throughout the pandemic and in the post-pandemic process. And it is worth mentioning that this role is reevaluated with this situation, since without the spatial component, this crisis cannot be understood. Just take a look at all the news related to COVID-19, and we will see that they all, explicitly or implicitly, show a map to analyze and explain it. In these times, geography is a key to monitor the spread and evolution of the disease, to learn how it spreads, to suggest strategies in order to help mitigating the impact and controlling its expansion. Nowadays, data visualization is essential to perform better territorial analysis. At an international level, perhaps the best known example is the Johns Hopkins University website, which shows data collected from various sources to observe the monitoring of this disease in different places around the world in real time. In the case of Mexico, from the Academy, there are various efforts on web viewers with the aim of sharing verified information on the current situation in the face of COVID-19. Among the best known, there is the iCovid-19 website, which is a visualizer of geographic data promoted by the Institute of Geography, where, among other elements, the vulnerability index to COVID-19 is displayed, which is a tool that geographers, geophysicists, epidemiologists, and mathematicians from UNAM developed. Another website where we can observe the monitoring of this disease is the one developed by our moderator, Dr. Marcela Santana, along with other colleagues from the Faculty of Geography of the Autonomous University of the State of Mexico, where, in addition to the general data of the behavior of the pandemic, cartography is generated daily. We can also find results on the perception of the population in the face of this problem. And it is possible to know if people are afraid or insecure or how they feel, because it is also a social pandemic and we have to address it in that way. In addition, there are some results of the spatial analysis that have been carried out to explain the behavior of this disease. There are other platforms of the National University of San Luis Potosí, the University of Guadalajara, and the University of Quintana Roo, among others, where a discipline is increasingly recognized for its capacity for spatial analysis of the facts and problems that arise in an increasingly globalized society. Through these contributions, different findings have been obtained. For example, governance as a factor that influences the rate of the spread of the disease, or the management of the health system, as well as hospital infrastructure, which help explain the speed and intensity of the spread of COVID-19. You can also see the population sectors where it is affected to a greater or lesser degree, where the most disadvantaged have a greater impact, having influence in their relationship with climate change, new education, human resource management, international trading issues, among others. Based on these results, strategic measures have been proposed for the design of the differentiated color-based epidemic risk measurer in the territory. As different authors mention, it is not a question of knowing if another outbreak will occur, but in reality, the question is when. So geography helps in the prevention of diseases and has very efficient tools to transmit information to citizens in moments where it is necessary to know what the situation of the community is. In addition, with the support of geotechnologies, it is possible, for example, to sort data from individuals and gradually add them in the same building, in the same block, or in the same basic health area, which allows working at different scales and making different decisions. For example, which areas to confine. Geography will continue to advance and become stronger, working as a team in an interdisciplinary and transdisciplinary way with other sciences, such as climatology, epidemiology, planning, and economics, among others. Geography is an integrative science that shares data, information, techniques, and methodologies to support the world's societies, collaborating with public and private institutions, epidemiological surveillance services, and in all areas, becoming essential in times of crisis, like the current one. I conclude my participation by mentioning that progress cannot be made in many aspects related to the pandemic. So the person who studies geography is the element that any society in the world needs in both the legislative and executive sectors.
Thank you very much, Dr. Giovanna. We are going to the next questions. With regard to the COVID-19 pandemic, how to explain that we are all in the same storm, but not in the boat? boat? Please, Dr. Eduarda.
Nice question. In fact, we are not in the same boat because the boats are different also, and cannot be everybody in the same boat. We have to sprawl in different boats, and that means that people and countries are different. And inside each country, people are also different. And the main driver could be the socioeconomic conditions. It's very important to understand these socioeconomic conditions. You can learn this by the point of view of the vulnerable groups and the others who have employment, not have employment, but inside, more in depth, we can see that we have people that have employment, but all the employments are not all equal. And in fact, some are more, they have more exposure to risk. And despite all the conditions, despite all the support of the governments, there are employments of risk, okay? That people that is working in logistic or in industrial activities are more in risk than people that are working in services and could be in teleworking at home. So that depends, in fact, the different conditions, what is the socioeconomic drivers of each country. The second point, it's interesting, it's the cultural aspects and the way we accept the orientations. And I suppose we have been assisting in case of Europe, emerging more and more people that says that all these restrictions are against democracy. And doesn't make sense. Something for me doesn't make sense that people consider that limitations is something against democracy. No, it's not. It's democracy, okay? We have to respect all. So to respect all, we have to have restrictions. And this different of comprehension of the needs that we have in this time in the world, it's also one of the reasons. By cultural aspect, we can accept more or less. By political and religious and cultural aspects, we can accept more or less some of the orientations. And we see that, for example, when we have the national day that is related with the commemorations with the religious natural, okay, and people go out because it's very important. We had this in Fatima, every 13 between May and October, we have big concentration of people in one municipality of the center of Portugal that is related with Fatima, Nossa Senhora de Fatima. And it was very complicated to explain people that they could not go to this municipality to answer to a promise they have done. And this is cultural and religious. So it's also important to understand this difference. And the third aspect is that all the governments doesn't think in the same way. And in Europe, it was clear that Swedish have promoted since the beginning collective contamination to be more a kind of a collective vaccination. The English were thinking in the same line, but they have changed in the middle the thinking. But you go Austrians or German, they have more restricted measures. But when we look at the results of this, we see that is not enough to the position of the governments, because the social economic, as I put it as first condition, the cultural and religious are the second for me, overlap all the decisions of the governments, okay? And that is a very complicated metrics to analyze. And I don't know if I have answered, but it's okay. Thank you.
Thank you. Thank you, Doctora Eduarda. We'll continue with Doctora Emmanuelle.
Yeah, I think that the Dr. Eduarda already said what most important to understand the difference between countries. I think it's, I can say that all governments took different decisions. So, and another aspect I can see very striking is the transmission of the decisions that are taken. I could compare with some country. I'm from Canada, so I was a bit comparing, and I think there is no many, even in the media here, that it's not so well transmitted to the population. So I wouldn't like to culpabilize the population for not following rules because it's not so well explained. There is also the cultural and socio-economic context that might be different, but I think it's important. Education is a really a big factor, is that we should, as scientific, as professors, we should insist on the transmission of science and explanation of what decisions should be taken based on the science. It's a point I could say to give more remarks about these questions.
Thank you. Thank you very much, Dr. Emmanuelle. I am going to talk about this question. I wait a minute. Excuse me. You can see?
No, Marcela.
No.
No.
Oops.
Because I don't. I am going to talk. The impact of the COVID-19 pandemic has been reported around the world. Each country registered its own epidemic curve, but the impact is different according to the social spatial condition of each territorial context, geographical, climates, hurricanes, floods, fires, etc. Environmental air pollution, demographic, economic, informal economy, social violence, cultural, lifestyles, comorbidities, epidemiological, appearance of other diseases, and political, health services and health policies, vulnerability and resilience, poverty and marginalization, among others. In Europe, the second wave has been registered in countries such as France, Italy, Spain, and the United Kingdom, among others. The region of the Americas has been the epicenter of the pandemic for several months. There has been no second wave, but spike. Worldwide, on October 1st, there were 45,972,994 cases and 1,194,482 deaths. The 10 countries with the highest value in number of cases are United States, India, Brazil, Russia, France, Spain, Argentina, Colombia, United Kingdom, and Mexico. These are developing and developing countries. The 10 countries with the highest values in number of deaths are United States, Brazil, India, Mexico, United Kingdom, Italy, France, and Spain. These are two, the developed and developing countries. The COVID-19 pandemic and social spatial condition for the case of Mexico, geographical a variety of climates, with the upper parts of the volcanoes in the Sierra Madre Oriental, Sierra Madre Occidental, and transversal neovolcanic axis. Hot climates in the south, southeast of Mexico, and slopes of the Gulf and the Pacific. Dry climates in central and northern Mexico, temperate climate in central Mexico. The coming winter may increase in the cases and deaths from COVID-19 due to the low temperatures, is the cool temperature and dry climates of Mexico. In addition to the fact that cases of influenza and respiratory diseases are expected to appear. Meteorological phenomena, hurricanes like Delta and others in the Riviera Maya, like the state of Quintana Roo, floods in the states of Tabasco, Veracruz, and Chiapas. Environmental air pollution in the main metropolitan areas of Mexico, Monterrey, Guadalajara, Puebla, and Toluca. Among others, a condition that worsens the spread of the pandemic. Currently, in India, there are serious air pollution problems in the city of New Delhi, a country that is in the first places of cases and deaths from COVID-19. Currently, some researchers point out that climate change is a factor that has influenced the development of the COVID-19 pandemic. Other researchers point out that relative humidity of the air reduces the risk of contagion, which points to the greater risk in dry conditions during the winter months. This is according to a newspaper of Jornada. Demographics according to the population projection in Mexico for 2020, there are 127,001,091 and 826 inhabitants, and an average density of 65 inhabitants per square kilometers. Worldwide, Mexico is among the top 10 countries with the largest populations. Mexico City and the state of Mexico register the highest population density. Belize with 6,073 inhabitants per square kilometers and 780 inhabitants per square kilometers respectively. The state with the highest population numbers are the state of Mexico, Mexico City, Veracruz, and Jalisco. As social aspect, violence and other repercussions of social isolation, vulnerability, resilience, poverty, and marginalization. In 2018, in Mexico, according to the National Council for the Evaluation of Social Development Policy, CONEVAL, the highest percentage of population in poverty were registered in the state of Chiapas, Guerrero, Oaxaca, Veracruz, Puebla, among others. Economic. According to the Mexican Institute of Social Security, IMSS, during 2020, in January and February, the number of jobs increased, but the period in which job loses, excuse me.
La escuchamos muy bien, doctora Marcela.
Gracias. Thank you. The number of jobs increased, but the period in which job loses were recorded was from March to July. Starting in August, job creation was registered again, according to federal government. However, the informal economy is the one that has had the most negative repercussions from the pandemic. Regarding economic activity, the primary one continues to develop, which is a favorable and fundamental condition due to the food supply to the population. The impact of the pandemic on industrial activities depends on the industrial branch, while the automotive industry has been badly hit. The electronic industry has had positive balance. The tertiary sector, which includes goods, services, and commerce also depends on the branch. Regarding education, it continues through networking. However, in the basic grade, there are problems, mainly in rural areas where internet is not available. Many other commercial branches continue through networking, thus opening up new opportunities in certain economic branches. Cultural, lifestyle, the comorbidity in Mexico is a very, very big problem because lifestyle that have an incidence in death from COVID-19 are hypertension, obesity, diabetes, and smoking, registered up to October 31st, 2002. The celebration of national holidays, such as the one of September 17th, and the celebration of religion holidays, both in urban and rural areas. Epidemiological advances in better protocols, medical treatment, and laboratories are in phase 3 for the generation of vaccines. A public health problem is that other emerging diseases such as dengue are emerging. Political aspects. With regard to the health services and health policies, spaces continue to be adapted to attend patients due to COVID-19, such as a mobile hospital, mainly in places where there are outcomes. Various federal government programs, such as support for the elderly, support for people with disabled to learn at home program, among others. Thank you very much, and we are continue with the next question. What will the new normal look like after the pandemic? All the questions I think that are very interesting. We are going to start with the Doctora Eduarda.
Good question again. Our new normal is already, okay? We are all already in a new normal. That's the thing we must assume for the next 2 years minimum, okay? And that despite having news from the vaccine, the Portuguese government have signed a protocol with the European community with the vaccine of Pfizer and another one, and it's a distribution for all the countries. But in fact, when that will happen to mass population, that's the question. So the new normal is now and will be for a long. If you consider the distribution of the grippe vaccine in the European context, we have a small share of people that is taking the vaccine of grippos vaccine. So the influenza are quite different year by year. And we have to assume also that this virus, that coronavirus, is changing also in the time. Since March, our public institutes in everywhere in the world, including the World Health Organization, tell us that the virus is adapting. And in fact, when we look at this second wave, when we look at different target groups that have been affected, it's not only the whole people, also young people is now symptomatic, is not so much asymptomatic as previously, shows us, and the literature shows us also that since September, we have a new mutation of the virus that is again more aggressive than in the beginning. So I suppose the nature is perfect. So the virus will adapt despite having a vaccine. So our new normal will be like this for the long. The question is, how is the resilience of the people to live with this new normal in the daily life? And how is the resilience of the economy to live with this new normal during 2 years? I suppose the resilience of the economy, it's more fragile than people, because people could adapt, not all, not in the same way, but people have shown us that have adapted. People have in a very fast way start to be at home, teleworking, solutions for teaching, solutions to have all the family at home, solutions in different way. But the economy is not have not the same capacity of the adaptation, so is not so resilient as the people could be. And that is the key issue. How the new normal could survive for a longer without thinking in solutions for the economics. Of course, the vaccines and the support for the public health is important, but we are in one thing that was not previewed, I suppose, for all the governments. Everybody thinks that could pay. If you could pay your system, you could have more doctors, you could have more equipment, you could have more solutions. But in fact, it's not like this, because people that are able to deal with this in public health hubs or in hospitals or in the key sectors are a limited number of people. We cannot have in 10 months the double of the doctors. It's not possible. So there are physical and limitations. There are political limitations when we related with this with the resources. So this new normal will be the normal for long. We cannot double the nurses. We cannot double the doctors and the capacity to answer, for example, for retired people that are in retired or nursing homes. The whole people that are in nursing homes now need the double of the people that are taking care of them. You double the work. These retiring homes need the double of the employees. And so the resources are limited in this moment, in the short time. So the new normal will be the normal for a long. It's my opinion.
Thank you very much, Doctora Eduarda.
Sorry.
We have 4 minutes.
Yes, I have to leave. Okay, we finish at 5?
In 5 minutes.
Okay.
Doctora Emmanuelle?
Sí, brevemente, shortly, I could say that, yeah, we will have a challenge in economy and in education, because there will be a lack very strong in education of the children, of poor children, because all is at distance and they don't have a hold the computers for that. And I think there is also talk about changing the economy on the green side. All the climatic change that is a topic that is not so hard as pandemic, because it will impact us also. So it's good that we have the reflection now in the same time, because when economy will be reactivated, we will have to think of climate change too, because it's linked to the pandemic, to the global health that we have. It's the topics I could say for the moment. And thank you for it.
Thank you very much. And we are going to thank the president of CSPC, Dr. Merdar Hariri, for giving us the opportunity to participate in this important event. We thank the Edna Mata for all the help, the support. I thank the panelists for their valuable contribution, Dr. Emmanuelle, Dr. Eduarda, Dr. Giovanna. I am grateful to Dr. Mirna Navarro Sanchez, research professor at the Faculty of Geography. She's helped us for the English traduction. I very happy for stay with us. Thank you, Marcela. We are going to other questions, or is that all?
Thanks to all.
We want to thank you, Dr. Marcela, for the panel organization, and to all the panelists and all the participants here today. Have an excellent day.
Have a nice day. Thank you very much.
And actually, we invite you to fill up the survey. I just put the link there. Thank you so much.
Thank you very much.
Have a good day.
Bye.
Bye-bye.